Hi, my name is Conor Galvin. I'm a fourth year medical student at Western University of Health Sciences in Oregon. I'm applying to internal medicine as my specialty. I'm very excited to be applying to that field and just thinking about a little bit about its tie to osteopathic medicine, not just the treatments themselves, but also just the kind of values and overarching tenets of OMM and how it ties into my field. I think one reason I'm excited about using OMM in my specialty is because of what a broad, kind of wide range of content, diseases, patients are encompassed within the field of internal medicine, such a diversity of cases. And in that regard, too, I think it's a lot of the patients that I see in my practice come in with a lot of multifactorial issues that can be influenced by kind of not only the immediate medical disease that they have, but also a lot of the underlying social factors, a lot of their backgrounds that kind of make them who they are. So in that regard, and kind of thinking about osteopathic tenets and seeing the patient as kind of a holistic person as opposed to just someone with a disease that they're immediately presenting with. I think it's been really important for me to keep that in mind as I treat these patients who do have multiple problems or a lot of things kind of outside of the immediate field of medicine that might kind of explain why they're in the condition that they're in. So always making a point to ask them just about transportation. Are they eating well? Do they have stable relationships? Do they feel safe at home? All those things that can really influence someone's overall well-being. And then on the second part of that, in terms of using the actual osteopathic treatments themselves, in the same way that I think internal medicine can encompass such a variety of conditions that need to be treated, the osteopathic treatments themselves not only allow you to just generally treat patients, but also provide kind of very targeted treatments that treat specific systems or with specific principles that might really resonate with the patient, and that might kind of help them in a way that kind of the traditional allopathic medicine isn't able to. So I've used a lot of soft tissue, a lot of counter strain, a lot of cranial techniques, things that can kind of help heal the patient physically and mentally and spiritually, and kind of get them to where they need to be from a health standpoint. Thank you so much for taking the time to watch this.